Hi, it's Dr. Rudy Kachmann. We're having our wellness talk again. I hope you've seen our past posts and our future posts. And today is, again, a very interesting and important subject because breast cancer can be prevented about 50 to 70%. And have additional news for you today. If you saw the Journal Gazette, June the 4th, a wonderful article in the New England Journal, Breast Cancer Breakthrough. And I'm going to discuss that after I take a couple minutes about breast cancer prevention is the cure, a book I wrote. And what am I really saying in this book? What I'm saying in this book is that if you don't smoke, drink no more than 1 glass of wine 3 days a week, say, and in terms of drinking, and keep a fairly normal weight, and not exposed to excessive toxins, chemicals you might have been exposed to, radiation on your chest, for example, that breast cancer can be prevented 50 to 70% of the time. When you consider 200,000 deaths, 200,000 cases a year at least, maybe another 50,000 of local ductal cancer, 40,000 deaths a year. If you could prevent a good 50% of that at least, I mean, it is a miracle, and it's not that difficult if you consider the things I spoke about. But let's get back to the newspaper article now. And what they're really saying is there's certain breast cancer which are hormone dependent, and they can run a test on you to determine if you're hormone sensitive. Okay, they've already found that if you're in the low risk group, and they calculate this risk by running genetic testing on you. It's called the Oncotype DX test, and if you're in the low, medium, and high group. If you're in the low group, they have now found you don't need chemotherapy. And that very important, because chemotherapy can be devastating to the people who take it, and it's very expensive. So now the good news is they took about, and they called this the Taylor X study, where they took about 10,000 people, 5 from the U.S., the rest from 5 other foreign countries, and they ran it for about 10 years. And they determined now the medium group, and they tested them by some received chemo and some did not receive chemo. And they found if they're sort of in the 11 to 16 group, the medium group, they found they don't need chemotherapy either. Wow. Now we're starting to talk about 85,000 people. About 85,000 women a year can safely forgo chemotherapy. Wow, that's a huge advance. So, and the study was done by the federal government. Pharmaceutical companies, weren't too interested because this decreased their business. And so the final recommendations by the government aren't out yet, but if you have this condition, talk to your providers, get at least a couple of opinions, and see if you need chemo or not. If you need it, you need it, okay? They also found that women age 50 or younger were the exception. Those with recurrence scores of 16 and above. Remember, we talked about the Oncotype DX testing, the genetic testing, that they did get a substantial benefit from chemo. So it was recurrence scores of 16 under age 50. They still should get chemo in addition to surgery, hormones. Remember, we spoke about the hormone sensitive. And the cancer which spoke about is driven by hormones that has not spread to the lymph nodes and doesn't contain the HER2 genetic code protein, okay? Those are the hormone-dependent group. So that it hadn't spread to the lymph node, They don't contain the HER2, the group that we are speaking about. So this really is wonderful news. So read my book, Breast Cancer Prevention is the Cure. After all, when you get testing and it's positive, you get cancer. Okay? What I'm saying is preventing it by not smoking, less than 1 or 2 or 3 drinks a week. None, if you don't drink at all, would be the best. Don't smoke, keep a normal weight, exercise a bit, and you knock the breast cancer rate at least 50%, maybe 70%. That's all just great news, and I hope you act on it, because breast cancer is so common. Men, incidentally, can get it too. Yeah, it's not just women. We did this talk today because we love you. Watch our other posts, read the books that we recommend, and you'll probably live to be 100. We love you. Thank you.